distinguished ladies and gentlemen, gentlemen of the press, let me start first by truly apologizing to our friends from the media for this delayed start of the briefing for today, Monday, the 21st of December 2020. Our deepest apologies for this very, very late start. As a matter of fact, there was a contemplation as to whether to proceed or not, and I felt strongly that having kept you all this while, it would only be courteous that we present ourselves. And if you are gracious enough, as you have been, to proceed with the agenda of the day. Having said that, let me also express my profound gratitude and appreciation to all of you, and to say that I felt your prayers and your love to myself and my family during the 1 week of isolation, and I want to thank you most profoundly for standing for us during our moments of affliction. And my prayer for each and every one of you is that when you need that kind of support and prayer, God in His infinite mercy will raise friends, colleagues to stand with you in the gap. I welcome you all to the national briefing for Monday, 21st December 2020. Over the past 4 briefings, the Presidential Task Force has been raising the alert flag on the rising number of infections in the country and the possibility of a second wave arriving at our shores. Recent epidemiology records confirm to the PTF that Nigeria is now facing a rise in confirmed COVID-19 cases nationwide, which is similar to the second wave of infections occurring in other countries across the world. Particularly Lagos, Kaduna, and the Federal Capital Territory have emerged as the new epicenters during this period, with over 70% of all confirmed cases. 2 major indicators highlight the current increase in cases and transmission across Nigeria. These are: 1, notwithstanding the fact that our testing numbers are fast approaching the peak recorded in July 2020, the number of cases being reported are disproportionately higher. For example, in the Federal Capital Territory, despite recording an increase of 85% in tests conducted over the last week, the number of confirmed cases increased by 285% during the same time period. And 2, these trends point to a higher test positivity rate, TPR, the number of positive cases detected as a proportion of all tests. The test positivity rate was below 5% through September and October, and we have recorded a low point of 3% nationally in late October 2020. However, recent trends in cases has seen this number increase to 10% in the second week of December 2020. These high numbers have further reflected in increase of admissions to COVID-19 treatment centers and fatalities, particularly in the 3 epicenter states and the FCT. The result of the analysis carried out by the PTF further indicate that the current pattern of spread and the surge is likely to be driven by the following factors. 1, lack of compliance with non-pharmaceutical interventions, particularly the disregard for mask use in public, large gatherings as a result of events linked to the Yuletide season, and recent civil demonstrations. 2, further disregard for other public health preventive measures such as hands hygiene and physical distance requirements. And 3, the activities and assumptions of our youthful population, which has resulted in an increase in the infection rate among young people who are subsequently infecting older and more vulnerable family members. Sad enough, I can report to you that one of the members of my household that are infected is a 1-year-old boy. So for the youth of this country who have always acted on the assumption that COVID-19 is for the elderly, this is bad news for you, that a 1-year-old child will be infected. From our assessment, the current situation are clearly the consequences of certain occurrences and events of the last few weeks. This include sudden increase in social gatherings involving large congregations from different parts of the country and the world at events such as weddings, religious activities, political rallies, conferences, and end-of-year celebrations. These events, classified globally as super spreader events, make the risk of a single infection causing a large outbreak among attendees significantly higher. And 2, furthermore, as we reopen the economy, we experience increased economic, social, and religious gatherings and activities, all of which have combined to play a part in the viral transmissions. This includes the opening of the international airspace in September 2020, while the average number of daily imported infections into the country in the last 90 days is estimated to be about 7 cases compared to 100 to 150 reported new infections in the community since the beginning of community transmission. The test positivity rate in travelers arriving in Lagos has recently doubled to 6.3%. B, the resumption of schools. Outbreaks have been reported in schools following the resumption of physical classes. And C, the resumption of NYSC orientation camps. This risk has been mitigated by ensuring that all NYSC members were screened for COVID-19 prior to admission to camp, but confirmed cases have still been identified through tests carried out. D, the full opening of offices with the return to work of government workers from grade level 12 and below. Outbreaks in this area have also been reported in public offices, most likely linked to overcrowding, poor ventilation, and the lack of compliance with non-pharmaceutical interventions. I can tell you authoritatively that in this complex, a certain segment of a department in this office where about 30-something people walk and congregate, after certain symptoms, tests were undertaken, and I can tell you that out of about 30-something people that were sampled and tests taken, we recorded infections in 16 of the 30-something people that were tested. So it means that the return of this grade of officers have further congested the offices, and something needs to be done about that. And E, the opening of the economy with progressive relaxation of restrictions in congregational areas such as places of worship, restaurants, bars, lounges, shopping, and event centers. As a matter of fact, we never allowed bars, lounges, and nightclubs to open. But somehow they found themselves open, and that could be one of the reasons attributing to the rate of infections, because those settings do not allow or permit for mask wearing. You also recall that the Presidential Task Force established the Nigeria International Travel Portal for the control of possible importation of the virus. Statistics show that a good percentage of inbound travelers have breached the travel protocols, thereby making surveillance and testing suffer undue setbacks. The following statistics will be of interest. As of date, 163,818 inbound travelers have been captured on the portal. Out of this number, 77,025, representing 47%, made payment for post-arrival testing. C, 64,405, representing 84% of the number, are due for post-arrival test. And D, out of 44,189, representing 69% that were due for post-arrival tests, only 44,118, representing 59% of those tested. And E, 20,216, representing 31%, have not shown up for post-arrival tests, though they have paid for it, thereby endangering members of the community and breaching the protocols they sign up to. 20,000 plus have paid for the test, they have arrived, and they have not bothered to show up for the tests, even after the period assigned for them to obligate themselves for the test had been reached. The Presidential Task Force has concluded arrangements with the Nigerian Immigration Service to impose sanctions on these defaulters for breaching the public health protocols within the ambit of the law. We gave adequate time for them to respond and conduct the tests. Calls were made personally by the appropriate officers to reach out to them, and having exhausted all these persuasive processes, we have secured approval to work with the Immigration Service so that the appropriate sanctions would be placed on these defaulters. The Presidential Task Force has surveyed developments and action taken by governments around the world, assessed our domestic environment, and has accordingly submitted its recommendations to Mr. President on immediate measures to be taken. Accordingly, His Excellency President Muhammadu Buhari, the President of the Federal Republic of Nigeria, having considered our recommendations, has authorized the PTF to engage with states and the FCT to assume full ownership of this stage of the response by deploying legal structures and resources, including enforcement, to manage the pandemic within their jurisdictions. Tomorrow night at 8 p.m., we will be meeting virtually with the NEC subcommittee on the response to to COVID-19 pandemic. And this authorization that we have received in these specific areas that I'm going to mention will be tabled for the consideration and adoption by the subcommittee of the NEC and by extension, a subcommittee of the Governors Forum for their implementation within each of the jurisdictions. In line with the authorization, the PTF wishes to issue the following advisories to the subnational entities, meaning the states, for implementation over the next 5 weeks, because these activities are considered super spreader events. We would be presenting to the states our advisories with regards to A, to consider closing all bars, nightclubs, pubs, and event centers, and recreational venues for the next 5 weeks. Close all the restaurants except those providing services to hotel residents, takeaways, home deliveries, and drive-in shall also be expected to be closed. Restrict all informal and formal festivity events, including weddings, conferences, congresses, office parties, concerts, seminars, sporting activities, end-of-year events, to a number of 50 persons, as much as they can. D, limit all gatherings linked to religious events to less than 50% capacity of the facility of use, during which physical distancing, mandatory use of face masks shall be strictly enforced. Where more than 50 persons are attending any such events, the gathering, as an advisory, should be held outdoors as much as possible to limit or prevent the spread of COVID-19. Public transportation systems are to carry passengers not more than 50% of their capacities in compliance with social distancing rules. We also advise the subnational entities to enforce compliance with the non-pharmaceutical protocols, especially the advisory on the wearing of masks in public places, particularly office environments. I just want to reinstate that these are not new protocols that we have put in place. They've existed all this while, but we want the subnational entities now to take greater and stronger measures and responsibilities, because we are at the stage of serious community transmission, as evidenced by the figures that we've had in the last couple of weeks. And two, to reduce overcrowding in public places, markets, shopping centers, offices, and schools, states are advised to implement the following: encourage virtual meetings in government offices. We started at the beginning of this outbreak by insisting on virtual meetings. Up till this moment, the Federal Executive Council meets virtually. Just a few ministers come into the council chambers. This was a council chamber that used to take all the 43 ministers. But at no given time do we have more than 15 ministers coming in now for the purposes of fake. Most ministers operate from their offices virtually. And we would want to see that enforced in all government offices, particularly at the national level, and as an advisory at the state level. All government staff on grade level 12 and below are to work from home for the next 5 weeks. We would enforce that at the national level, because the head of service of the Federation will be issuing out notices to this. As an advisory, we're also asking the states to consider that, so that they can decongest their offices and reduce the volume of people coming to work, so that we can effectively interrupt the spread and transmission that is taking place now. Permanent secretaries and chief executives are to be held accountable for enforcing MPI rules in their domains with frequent spot checks. The PTF, on the advice of the Federal Ministry of Education, expects that schools would have vacated from the 18th of December 2020 and remain closed till at least the 18th of January 2021 to enable the measures introduced to take effect. All persons, as an advisory again, above the age of 60 and or with comorbidities are to be encouraged to stay at home and avoid crowds. And please, all non-essential travels, both domestic and international, during the holiday season are seriously being discouraged. Looking at what is happening globally, we need to take a cue from that. And 3, to strengthen risk communication and community engagement activities over the next 5 weeks, states are encouraged to engage community and religious leaders, arrange town hall meetings, ideally set outdoors to address concerns. B, intensify public messaging activities, leveraging on existing government and partner assets. C, reach out to youth and younger adults with health promotion activities, especially taking cognizance of the example that I just cited, that one of the members of my household that tested positive is a 1-year-old boy, just 1-year-old boy, tested positive to COVID-19. So this kind of messaging should go out so that our youthful population would know that they are not exempted from COVID infection. And D, invest in local face masks purchase and distribution to the general public to encourage its use. Some state governments have started doing that. As I said earlier, that some state governments have also started implementing even what is contained in my remarks this evening. Some have even gone further than what we are suggesting. But we want to harmonize, as we are meeting with them tomorrow, these guidelines, and we would put it across to them for their consideration and implementation. 4, where applicable, the Presidential Task Force shall also implement these authorizations, like I said. For example, it shall work with the Nigeria Immigration Service to impose sanctions on all inbound travelers who violated the travel protocols and endanger the lives of their loved ones and other citizens by refusing to take the post-arrival test. And 5, the PTF will similarly work with the head of the Civil Service of the Federation to implement aspects related to public service. A lot of discussion is still going on around the calls for the restriction of international travels due to the discovery of new strains of virus in certain countries. The PTF, the Aviation Authority, and the health authorities, including the World Health Organization, are assessing the situation closely and will take a position as soon as cogent scientific bases are established. The protection of Nigerians remains our primary concern, and we reassure Nigerians of our resolve not to relent in this. Tomorrow, Tuesday, the 22nd of December 2020 at 3 p.m., the Presidential Task Force shall be submitting its end-of-year 2020 report to Mr. President, and Nigerians shall be kept abreast of this development in this regard. As I conclude, let me urge each and every one of us to understand that we are in a very difficult time and make this passionate appeal that we need the support of all Nigerians and the support of members of the fourth realm in really driving this message out there, that we are at a crossroad as a nation because of the rising case of COVID-19. And we need to do everything within our capacity to ensure that it does not escalate to a stage where it would overwhelm our people and overwhelm the health infrastructure. Right now, spaces within our treatment centers are being overwhelmed. If you have any cause to do any investigation, journalistic investigation, go to the Gwagwalada, which is our main treatment center. The story is that the system is being overwhelmed. And not only Gwagwalada, most of the hospitals where we have isolated infectious treatment, either wards, they are being overwhelmed. Well, my experience, between March 17, when I became chairman of the COVID-19 Presidential Task Force, to the end of November, I didn't have a single infection within my household. But within the period of December, well, there was one, a driver who, when we were advised to reduce our personal aids and staff so that we don't decongest our environment, he was asked to go home. And when we thought we had flattened the curve, we decided to recall him. But before coming to start his work, I decided that everybody must be tested. And he tested positive. He went to the isolation center. That's about the end of November. Went to the isolation center, and glory be to God, he weathered the virus and recovered. So up to the end of November, within my household, within the confines of my household, not even one. But in December, early part of December, I think the second week, which is precisely about 10 days ago, I was rudely awoken to the dangers of COVID-19 as the chairman of the Presidential Task Force. From a test of about, how many people were there? The first test we ran, the results came back with 6 members within my household testing positive. The second test confirmed another 3. From none within the month of March to November to being confronted with a figure of 9. It was quite a traumatic experience. And the reality of what we are dealing with as a nation confronted me. My wife and I consistently tested negative. But members of the household were affected. So every thought that you could imagine, every insinuation of how it got into my household as the commander-in-chief against COVID-19 wrecked my head. I'm sharing this experience so that we all know as a people and as a nation that COVID-19 is real and is no respecter of office or persons. And it is waiting for the vehicle that will convey it to the next recipient. And it can come in through different sources. So the question of taking personal responsibility becomes so obvious. There's little the chairman of COVID-19 can do even to protect his household. Except members of that household take personal responsibilities for their lives. And I'm saying it that as we go into this festive season, the Yuletide season, a time of celebration, a time of joyous festivity, absolute care and caution is required. You wouldn't want to go through the experience that I went through. The last 1 week was a nightmare. I was not infected. But the truth about it, the agony of having members of your household. I'm a father of 4. All my 4 kids were infected. So the agony that you go through even as a father, as a parent. A lot of you here sitting here today are parents. So you need to do everything you can to ensure that you keep yourself safe, you keep members of your family safe. There's no thing that you should not do. And the application of the non-pharmaceutical measures, probably, like I told you, I have shared here severally as a joke that oftentimes when I sit in my house, I'm wearing a mask. Probably that singular act of wearing a mask within my own household could have been the reason why I was not infected. And the mercies of God, which is always available there, that you cannot discountenance. But I know too that I have a responsibility. My wife knew too that she had a responsibility to protect herself. I'm not saying that my kids and the other members of the household didn't do what they were supposed to do. But how did it even get to my house? COVID-19, not a fear. It got to my doorsteps. I'm sharing this with you because so that if you are ever laxed about how to deal with this, it's a very serious business. And I'm speaking to all Nigerians that are listening or viewing, that this is not the time to politicize COVID-19. This is not the time to trivialize it. I have lost more close friends in this second wave of 1 month than I did from March to November. Some of them sat beside me on the 8th of December. Some of them I was at a function with on the 28th of November. Some I spoke to the night before they died. So when the figures are being released, for me, they are not statistics. They are faces. They are people that I can place faces to. So folks, we are in for a very difficult time, but I know with the support of Nigerians, with your cooperation in the media, we can weather this storm. We can navigate these difficult times. But it won't come if we embark on a reckless journey of trying to navigate this storm. It must be decisive, it must be consensuous, it must be focused. And I can assure you that the men of the Presidential Task Force and the ladies of the Presidential Task Force were resolved and determined to do everything humanly possible to put before Nigerians measures that we believe, by the help of God, will protect our population. COVID-19 will not go on any recession. Economy can be in recession. COVID-19 is not on recession. Yes, this is a Yuletide season, the time of merrymaking, the time of mingling as a family, the time of sharing in the joy of the season. But recklessness cannot be part of it. And we must take every step possible to protect ourselves and protect our people. I want to thank you for the support that we have received from you and to urge you to continue to support us the more as we go through this very difficult season and times. And to also apologize most profusely again for the time that we have taken. But I think it is all for the good of our nation and for the benefit of our people. Thank you and good evening.
Thank you very much, the PTF chairman, for speaking from the heart. We have been deeply touched by those experiences you shared with us this evening. I wonder whether we still